This is Dr. Howard Strassler with a Hints from Howard on Light Curing, and today we're going to talk about how to choose a curing light, some guidelines to choosing a curing light. Let's take a look at what we're light curing. All our restorative materials, sealants, ceramic veneers, ceramic inlays, non-lays, fiber posts, bases, and liners, and they're using light curing in the dental laboratory as well. And central, key to the success of the restorative materials we're using is the curing light, because the restorative materials we use are specific energy dose required, and we need to be able to develop that amount of energy to get the performance that the manufacturers intend. Let's take a look at some light curing terms. You know, when we talk about power and energy, think about a light bulb, a 60-watt light bulb versus a 100-watt light bulb. And from these light bulbs, how much energy and what type of energy will you be delivering with these light bulbs? In fact, most curing lights are measured based upon what's called irradiance values, milliwatts per square centimeter. What is the power that's being distributed over the entire surface of the tip? And as you can see, irradiance refers to that level of power delivered over the tip, but the energy needed to cure our composites are delivered over time. How much time is the light on? We need less time for higher irradiance lights and more time for lower irradiance lights. But keep in mind there is a minimum amount of time that composites require, what's referred to as the reciprocity factor. Not only do we need a certain amount of energy, but we need the right type of energy, the right type of light spectrum wavelength. And the majority of curing lights we use today are in the blue spectrum, between around 440 and 480 nanometers. And our composites are keyed to those lights, most composites that is, because in recent years we've seen lights that have both blue and violet LEDs, so that we're getting an irradiance value of 1200 for this light. That's a combination of violet and blue, but is all of this spectrum of light usable by the composite for photoinitiation and photopolymerization? And so we need to match our curing light to the composite resin that we're using. So we have choices in photoinitiators. In fact, the manufacturers have choices. Our curing lights, we have choices in a single peak light with the blue wavelength we talked about, or a poly wavelength which has the violet and the blue combined, and that the manufacturer has the ability to choose from a camphorquinone, a blue-sensitive photoinitiator, or a TPO, a lucerin, which is a violet-sensitive photoinitiator. And so different photoinitiators require different light sources, and so you need to match and know the composite you're using, what wavelength does it need, and what wavelength is your light producing. And I have to tell you that 95% of the composites are camphorquinone, CQ. And so it's really not that much of a problem. But if you're not sure, ask your manufacturer's representative, ask your dental dealer's representative. Because Ivoclar happens to develop their own photoinitiator, one that provides a deeper depth of cure that is in the range of both violet and blue, as compared to standard photoinitiator systems, which are using blue predominantly on our right, or violet predominantly. And the reason why they went to violet photoinitiators was violet photoinitiators tend to be clear and give us a truer color of the composite, although camphorquinone, which is yellow, does bleach out. And so do you use Ivoclar materials, you might want to use lights that have both violet and blue photo emitters, LEDs. So how do you measure the irradiance of your light? Well, you can measure it using radiometers, and the radiometers that you buy today are generally inaccurate. For these radiometers that I'm comparing a light, the manufacturer states the light at 1500 milliwatts per square centimeter. The actual output of this light, when measured with a laboratory grade radiometer, is 1120 milliwatts per square centimeter, and yet with 3 different curing lights, I'm getting 3 distinctly different values. In fact, if I had the same radiometer, I'd get a variety of values because these radiometers are really not calibrated as laboratory instruments. Keep in mind, radiometers do have value. Even though they're inaccurate, they are useful for monitoring changes via log. And so you can see whether or not the light is providing the same amount of energy week to week, month to month. One recently introduced radiometer has the accuracy of what we use in the laboratory to measure lights and other instruments, and it's the Blue Phase Meter 2 from Ivoclar, which is accurate with any curing light, has a wide wavelength range, and a wide irradiance value. So do you know your curing light? The whole variety of different curing lights that are on the market. For the one you're using, do you know what it